Malo la malia e tonga koto, pa malo ai la malia Hawaii pelele e tonga koto, mo mea mai ki po klama e whawhini, ka po klama e tonga World News, pia ka whawhini o kuata ngahi update me tonga, pa ki mua ke tau hoko atu, ke tau kamata ki pe tau lotu, ha tau himi, ki mua ke tau hoko atu, malo.
Joseph Scriven, who wrote What a Friend We Have in Jesus,
was a Canadian schoolmaster, and he was a member of the Plymouth Brethren. What a friend we have in Jesus.
In 1979, the FDA approved PEMF therapy for the healing of non-union fractures. In 1998, the FDA approved PEMF therapy for urinary incontinence and muscle stimulation. In 2004, the FDA approved PEMF therapy for cervical fusion patients at high risk of non-fusion. In 2006, the FDA approved PEMF therapy for treatment of depression and anxiety. In 2011, the FDA approved PEMF therapy for treatment of brain cancer. On October 13, 2015, the FDA reclassified PEMF devices from their existing Class 3 category to a Class 2 status. And most PEMF devices that are sold today in the United States are FDA registered as wellness devices.
Presently, people in communities are facing various health crises, including the top 10 health killers. World statistics shows that 54% of the population is facing deadly consequences from these diseases. The reason why people are suffering from chronic diseases is because diseases are becoming harder to be treated with radical treatment, and it can only be alleviated or controlled with medication. People starts to pay attention to eating habits, daily exercise, and consumed various health products when they face such diseases. Most of the time, it's already too late especially in environments that are unhealthy and polluted. When patients are suffering from these diseases, it inflicts tremendous stress, pain, and sufferings on their families or siblings, saying, therefore, we must search for the best alternative solutions to resume a normal and healthy life. All efforts should be focused on the most basic issue of a human body, cells. The core cause of most diseases is linked to cell deficiencies. Collapse of body function is caused by a weak immune system, clogged blood vessels, damaged and mutated cells, and etc. All of these are the root of serious diseases. Presenting iTeraCare therapy device, a product to the new era in health wellness. The iTeraCare terahertz wave frequency is found between far infrared and microwave, with a wavelength between 30 and 3,000 microns, which is the same wavelength absorbed by human cells. When cells are irradiated by terahertz frequency, it rapidly enhances energy into the human and activate inert cells. Its radiant energy is only 1/4 of sunlight and 1,000th of a mobile phone frequency. Research shows that it is completely safe for the human body absorption. The penetration of the terahertz frequency is able to reach 20 to 30 centimeters under the skin, internal organs, and bone marrow, constantly unclogging and cleansing the blood vessels and lymph in the body. Thus, simultaneously improved microcirculation, reduces coldness, reducing tumor, skin nourishment, repairs unhealthy damaged tissues, remove necrosis, healing of internal organs, and further strengthening the cells. The principal treatment of iTeraCare is to unclog capillaries to enhance the body and cells to function healthily. iTeraCare therapy device integrates 3 top technologies: terahertz, quantum, and optical quartzes. The crystal energy tube is its core component, is casted together with more than 100 trace elements. iTeraCare device certification is stringent tested, inspected and certified by China Beijing Academy of Science and National Intellectual Property Right and Patent Certification and other authoritative organizations related to the device. The iTeraCare therapy device intelligently identifies healthy and bad cells. Good cells will pass through the device's consistent frequency and temperature, and bad cells will be liquefied by the heat, which will be expelled from the body through sweat, urinary, and defecation. With preventative and protective functions against human diseases, iTeraCare therapy device is a very effective treatment for 3 major sub-health problems: inflammations, skin disorders, and clogging. The 10 major advantages of the iTeraCare therapy device. Number 1, the 8 extraordinary vessels of the body. Number 2, pass through the 12 main channels of the body. Number 3, scrape the toxic and harmful substances from the body. Number 4, remove superfluous things that are not part of the body. Number 5, find potential diseases using a scanning function. Number 6, unclog channels and spaces in the body. Number 7, detoxification. Number 8, regulate internal organs and immunity system. Number 9, replenish the body with yang aura energy. Number 10, repairs damaged cells and tissues. Thrive International has a strong, positive, and experienced management team that is focused and committed to promote.
Melanie, unmute yourself.
Sorry that. welcome
Yeah.
back. And tonight, for those of you who just tuning in, we have Dr. Ray Ebrahim from Tonga. And for those of you who don't know Dr. Ray, he is a neurologist, neurosurgeon in Egypt, a herbalist in Tonga, and he's also the owner of the Genesis Clinic in Tonga, and an expert of the frequency therapy since 2002. So, Dr. Ray, welcome. And I'll give it to you to share with us the amazing iTeraCare that you have in Tonga. And we're going to go back to you right now, Dr. Ray. Back to you. Can you hear me, Dr. Ray?
Okay. Yes. Sorry, because the internet is not stable.
Okay.
I wish for everyone happy Father's Day. Today we have in Tonga Father's Day.
Yes.
So beginning, I want to
Sorry,
explain
forgot
about
that,
the
Dr. Ray. Happy
technology.
Father's Day to you.
I remember first arrived to Tonga. Yeah. Can you guys hear me?
We can hear you loud and clear. Okay, I guess we had Dr. Ray drop off, but then happy Father's Day to you, Dr. Ray, and all of those fathers out there. I know ko American yung tigay ho ko Father's Day, but nga long yung Father's Day ato nga hay ahoni. So wata talamonu kay nga tamay ko tope o mo ito nga hay aho ko ini. O pa pena mo mao ha aho sa pate tamay lele. Pia Wangai fatongia og mofua kay ulo family so kay ki programa fa fini kay o atu foki programa ko ni o ki misini ko ni kay frequency therapy while we're waiting for Dr. Ray ko fi mai atu ki talanoa na o mai kay fina kita o ni mafa na ulea ki ai he wiki ko ni koe palapalema ko nai hoko ki a te ia, nai tafa koe kansaha no kete, pea ula ki tafa, pea nau hange ka whatapuna, nau hanga te use konga ai ngā kau, pea hoko tafa hono wa, pea na e te whaipe mea te tau, pea koe whika tolu, pea osi lewa talanga lewa e he toke tā, koe tafa wha osia, pea kai le te iaha no whainga maari I tell you, koe programa koe ki mo a koe ni o wike ko o si na ia ia ki ta wafa na e hoko ai kansa ki te ia I hono ate. Dr. Ray, are you okay? Are you back now? Can you hear me
Sorry, the
okay?
internet.
Okay.
Yes, I can hear you. So I remember when I first arrived to Tonga, they what I heard they not familiar with the technology, and they said like we are not familiar with your technology. Then I told them it's not my technology. I'm not the creator of it because this technology been since 1978.
Right.
So for me, it's good when you open your eye for another technology because that's how we go far with medicine and treatment. When we talk about frequencies, let me explain to you. Our body have different frequencies, like each system and each organs and each tissues, they have different frequencies. As if you look to the earth, so you found we have the like island, any island in the world, the frequencies there it's so less than any other countries. So the frequencies, for example, in Tonga, in Fiji, in Samoa, Solomon Island, is different than America, different than Australia, different than New Zealand, different to any countries all over the world. It depends about how far they from the water. When people have stress or depression, they ask them to go to a quiet area. Yeah.
Okay.
But this quiet area, they are most probably like go overseas. People like go to Vietnam or um, Fiji or Tonga. So this island there is low frequencies because of the salty water around us.
Oh, okay.
And we are so lucky. Yeah. Sometimes like 80% to 90% when you have high frequencies with high pollution, like carbon dioxide or nitrogen dioxide, this can cause more problem, like more toxin with high frequencies. This definitely can cause a lot of health issue. Let me start from the beginning. When the Israel scientists with NASA, they study about the gravity, and we are so lucky. If you want to understand this type of technology, you need to mix between physics, which is the understanding of gravity, and chemistry, biochemistry, and then we talk about the cells. Um, for the beginning, and when I start to explain from the scratch. Our body built by one atom and one cell. Okay.
Okay.
So when I talk about atom, we talk about chemistry. So if you put water on the stove or in a microwave, okay, you can boil the water. If you put it in the stove, the water will be boiled by heat. The
Right.
source will be heat. When you go about microwave, the water will be boiled by frequencies, which is
Oh,
electron. So the microwave here, when you put stuff on a microwave, it starts heat from the middle all the way to outside, like from inside to outside.
okay.
And that's how you energy inside the atom. Why I said this introduction? Because we have here disease. The definition of disease, if you Google the definition of disease or go to any medical reference, the disease is cells disorder.
Mm.
So this disorder can happen by accident, can happen by genes like genetic, or can happen by um, infection. If I talk about bacteria, or by virus, or by fungus, or promatosa, or by viral. So there is a lot of causes here can cause cell disorder, which is can cause disease. Okay.
Okay.
In 2002, we've been able to take a video of our cells, and we found the people they have cells disorder compared to the people in the same area they normal. We found the atom is not moving properly.
Mm.
Okay, so here we use the gravity, we use frequencies. Okay,
Okay.
do you remember when I had the gout show, when I explained about the gout?
Right.
The gout, and people drinking more water, they will be less to get gout.
Right.
Okay, because the water is break down the uric acid. There's
Right.
two things here. You can break down the gout by drinking water or by heat,
Mm.
and the melting point of the uric acid, it's 390 Fahrenheit.
Okay.
So at the end of the day, you can, as I said before, you can't just like barbecue yourself.
Right.
You can't. Like otherwise you get burned. You would
Mm.
die. But we can use here a friendly frequencies to go through your body to trigger the area with gout.
Right. So when we do the count, Dr. Ray, you just have to blow the device directly to the area of count. Is that right? Uh, I think the internet may tonga ako COVID kaku. I'm going back now ki uh formatala ko na ninay na hoko toy. Uh, okay, back Dr. Ray.
Yeah. Can you hear me again?
Yeah, I can
Yeah.
hear you okay. Yeah,
If we
go ahead.
talk about yeah, if we talk about the prostate, people have enlarged prostate or prostate cancer.
Right.
First of all, when we go about radiation, okay, or chemotherapy. So chemotherapy here, we use chemistry
Okay.
to break down or to kill the cancer cells. If you talk about radiation, which is mean here, we use frequencies. Okay, you get the idea.
Yeah,
But the
okay.
radiation using frequencies, high frequencies.
Okay.
So during the radiation, they will get advice from the doctor. If you have kids, don't come next to the kids
Okay.
because you will be in high frequency. That will affect the kids around you.
But how long?
So
How
when we
long
talk about
next to
iTeraCare,
the kid? How long they have to prevent that from the treatment? I mean, do not close to the
okay,
kids.
there is two type of radiation here.
Okay.
Radiation, you must be away from kids or from pregnant women. So if they will ask you, do you have anyone pregnant or you have kids? And during the radiation therapy, you not come to them. Otherwise, you're threatening their life.
I see.
When we talk, but with other type of radiation, they use less frequencies, which is okay. You still can go around kids or pregnant. It depends. Especially if we go to the thyroid, when people have thyroid cancer or overactive. So we need to reduce it down. So here we can use the radiation as what you call solution. Okay, one of the solutions. So at the end of the day, we use chemistry and we use frequencies. When you go and buy medicine, what this medicine, we call it drugs.
Yes.
This medicine is created by what? By chemistry, atom plus atom plus atom equal the result for what we've been getting for. So here, with this technology, when we use the technology, we focus here about what this tissue or what this organ or what this system need. And then when you take it and use the frequencies, now you will get healed fast because I give the cells what the cells need and then activated by frequencies, which is here I use we call it natural or alternative medicine, like vitamins and minerals, and then I activate it in this area, the one I want to fix. For example, people have knee problems, okay? Or people have some of the spinal cord problems like cartilage, okay? So we give them glucosamine. And when the people start to take the glucosamine, and then I use the iTeraCare or the frequencies, they get fast benefit and faster. When people have cancer, first of all, we need to stop all the inflammatory food like sugar, sweet, fast food, fried food, barbecue, because the barbecue, they have a lot of carbon.
The meat is the red meat is bad, huh? Red meat.
Look, I tell you what, you need 100 gram a week of red meat.
Okay.
Okay. I know people, they said I'm eating healthy, I'm vegetarian,
Right.
they destroy themselves. To be honest with you, with all my respect, again, in medicine we work with theory. But for example, here, when people are vegetarian, we have the most important. I'm not saying about organs because it's not organs, but if you look for the nerve system covered by something called myelin sheets. So the myelin sheets here, it's made of phospholipid. So if I have the nerve, if you have like a cable like this, there is electricity go inside. Yeah.
Right.
Can you imagine if there is no cover and you touch it?
Right.
What will happen to you?
Get shocked. Electrical.
Perfect.
Yeah.
Yeah. So the myelin sheets, it's cover the nerve, and how strong your nerve you are, it depends about the myelin sheets and vitamin D and sodium
Mm.
and the potassium. So we have sodium, potassium, vitamin D, and we have outside the phospholipid, the myelin sheets. The problem here, when the people are vegetarian, the phospholipid, your body can't make the phospholipid by itself. Like your body can make vitamin D. Okay? You can get vitamin D from any source. You can get vitamin, but the problem is vitamin B. Okay? Some vegetables, they have vitamin B, but the source here is not come from here. Like when we talk about animal organs, okay, like liver, stomach, the intestine, what you call it, like kidney, this type, they reach of the phospholipid, and that's how you get your nerve system getting stronger.
I have a question on vitamin D,
Okay.
Dr. Ray.
Yeah.
You know, I know there's D2, D3. So what is the difference of the? Is this a different classification or they're all the same? Because I know the doctor prescribed D2 to my husband
No,
and
they are different.
D3. Uh, Go ahead, Dr. Ray.
Okay. They completely different. We have under our skin, we have a layers of lipids. So
Right.
when you walk on the sun light
Hmm.
or the sunshine, now these lipids with the sun heat, okay, they transfer to something called vitamin D1. D for
Okay.
delta or dog.
Right. D delta. Right.
D1 go on your bloodstream. Nothing in your cells recognize D1. The only thing recognize, the only organ recognize D1 is the liver. And then the liver convert D1 to D2.
Okay.
And then D2 goes through your bloodstream. Still, your cells can't recognize what is D2. And when the D2 reach the kidney transfer D2 to D3.
I see.
Once it became informed D3, your body recognized D3.
Okay.
Nowadays, because people are stuck on the office most of
Right.
the day, okay, they are not working outside. That's why we have vitamin D supplement, D3.
Right.
In 2013, they discovered something called D4,
Oh, wow.
vitamin D4.
Okay.
And D4, the intestine, when they found D3, they can convert it to D4, and D4 is protecting your body from cancer.
Okay.
So the end of the day, we have D3. And how
Okay.
strong your intestine, that's how you can get D4.
Okay. But my
When you
question,
have
Dr. Ray,
D4,
Okay, go ahead. Finish up that D4.
When you have D4 and you have B17,
okay,
vitamin B17, usually 99.9% for people, they have cancer. They are like vitamin B17 deficiency.
Okay, Dr. Ray, I have a question for you on the vitamin D and the iTeraCare right now, because iTeraCare have the sunlight and the sunshine. So how much vitamin D that I need to take if I'm using the iTeraCare? And before you answer, Dr. Ray, let me answer to Leola. Leola, you will get it from me, but I will. You need to call me after the show so we can process the payment, so we can ship your machine out to you in 2 days, 2 business days. Okay. So call me after the show. I guess so. Tao kay problema pa internet may tonga. Leola, if you hear me, after the show, can call me. Kaya nga misini Mateo. I think kami sini oku Amerikani oku tolngaw ni Manoa. We have Dr. Ray back now. Okay, Dr. Ray, did you hear my question?
Yeah.
Can you answer my question? I have that device at home and I'm still taking the vitamin D. So do I need to reduce my vitamin D while I'm using the iTeraCare, because there's sunshine and sunlight in it?
Okay, that's a good question. Some, let me say like 50-50. 50% of the doctor they call vitamin D is hormone D. And why we call it as hormone? Because your body produce, and when your body produce something we call hormone. So some doctors they call vitamin D it's hormone. Okay. For healthy body, you need vitamin D to be 75% at least. Okay. When we talk about vitamin D, your brain needs vitamin D, your heart, your lung, your gland, your kidney, your tissue, your hair, your skin, everywhere in your body need vitamin D. When I talk about the cells here, our body 3 trillion cells. And the 3 trillion cells, they need vitamin D. When we talk about the nerve system, how strong your nerve system, it's according to how strong your vitamin D. Because the vitamin D, it's open and close for the nerve message. So when you see people, they have vitamin D deficiency, they're responding or they acting low than other people, vitamin D is normal. Okay. So for when we talk, like if you talk 1,000, when we talk about the doses of vitamins or any medicine, we have something called therapeutic doses. Okay. Therapeutic doses, if you have vitamin D deficiency or any disease, we call about therapeutic doses. When we talk about vitamins and minerals, you have something called RDI, the recommended daily intake. So the RDI, the recommended daily intake, this show you the amount how you need from this vitamin or these minerals daily. Okay. When people have high blood pressure, that can cause by vitamin D deficiency. When people they have calcium problem, a mate or numb on the hand and foot, because the calcium is high.
Okay.
So vitamin D here play roles in your body to restore the calcium in your bones. If the calcium not restored in your bones, that can cause kidney stone or can cause another problem on the nerve or the brain, or can cause heart attack when we talk about calcium. So we need vitamin D. If you take 1,000 units a day, that's, for me, it's like you drink when you are thirsty and you just drink one drop, not even one cup. So 1,000 units of vitamin D3, it's not this thing you think about. Take up to 10,000 units a day.
Okay.
With vitamin D, there is no toxin in vitamin D. There is no toxin in any vitamins and minerals if you go up. The only thing as a side effect of any vitamins to go high is diarrhea.
Okay.
So when people have constipation, number 2, if they took vitamin C like 8,000 units a day, that definitely can cause diarrhea.
Dr. Ray, I have a question from...
Like it's other treatment for constipation.
Dr. Ray, I have a question from one of the viewers. She said she took like vitamin D3 5,000. Is that okay?
Yeah, it's perfect.
Okay.
She can take up to 10,000 or 50,000.
Okay.
Look, I tell you, you can take up to 200,000 units a week.
A week, yeah? Okay. So
up to 200,000 units a week.
Is that 5,000? Is
and when I talk about this, 5,000 times 7, that's 35,000.
Okay,
Yeah,
but
it's a
how
good
much
one.
would be every day?
If you found 5,000 units a day, that is perfect. The what?
Okay. So 5,000 a day, is that right?
Say it again.
I wanted to ask her if she's taking 5,000 a day or how many a day. So
5,000 is perfect.
For a day, okay. Okay.
If she's not vitamin D deficiency. But if she's vitamin D deficiency, 5,000 is nothing. I can go up to 50,000 a day if she's vitamin D deficiency. If she's not, like her vitamin D around like 50%, 40%, 5,000 is perfect. She can go up to 10,000. It's all perfect. As I told you, all your cells need vitamin D to function.
Okay. Leola, you can come
so
online.
5,000.
Send me your email, and I can have you come on live and then ask questions to Dr. Ray if you want to. Send me your email.
Yeah, she's more than welcome.
Yeah, she's more than welcome to come in. Leola is in Texas, and this is nice that we are able to answer her question. But Dr. Ray, I wanted to share the story of the lady in Tonga that I spoke to, had the stomach cancer. If we can share that a little bit. While I'm trying to see if Leola can come in, just put your email down here, Leola, and I'll send you a link to come on live. But back to you, Dr. Ray. Go ahead. Yeah.
This lady is 54 years old. She has 3 surgery. First surgery, it's done by one of the surgeon in Australia. They cut some of the hair of her intestine.
Okay.
Because she have intestine cancer or colon cancer, for people to understand.
Okay.
So they cut some. And then couple of years she get another cancer, so she has another surgery, they cut. And then she get another one, so she done the third surgery and they cut. And that's it. So since this time, she's been now was over 2 months. She's not eating, she's not drinking, and even every time she drinks, she's vomit. She's in a lot of pain. Even she can't walk, and she's wearing diaper. But now she's not wearing diaper because she can walk, and she can eat, she can drink. That's the one you talked to her.
Yes.
We have, but again, it depends about how we use the device and where you use the device. It's not about it you watch on YouTube and you said, "Aha, I will do the same." No,
Right.
because each area in your body, they have different frequencies and different uses of the device. You can have a car like what you call like Porsche or Lamborghini, Leo.
Yes.
But at the end of the day, if you don't know how to use the car or how to drive the car, there is no use.
Continue, Dr. Ray. I'm just waiting for the lady to come on live to join us. So
Okay. So what I'm talking about, you need to know how to drive the car and which car you drive. So here, you need to understand the device and which device you use and how you use the device.
right.
Can you hear me?
Yes, I can hear you loud and clear, Dr. Ray. Just continue. Yes.
Yeah. So what we try to do now with the company, we try to do more tutorial about different disease in our body and how you use the device and what frequencies. And like for me now, I start to write the proposal, and what I ask the company to have the technology here in Tonga.
Right.
The end of the day, I'm Egyptian, Australian, Tongan, but I love Tongan.
Love Tonga.
And I wish to have the technology and the school of this technology in Tonga.
Yes. Okay. Leola, turn
So
on your camera. Okay, so can you hear us, Leola? We have Dr. Ray, we have Leola coming on live to us here, but from Texas. So you can turn on your camera and turn on your audio if you can hear me. While that technical thing, Dr. Ray, let me little bit explain, because I spoke to the lady. I wanted to say this in Tongan. Diala kay whanau mai?
Iyo, go whanau.
Okay, loud and clear. You can turn on your camera if you want to. Or you can just come on, the voice is fine. And then we have Dr. Ray here, and we would love you to ask any question. Leola is also a friend of the ball. Hello. She also lives in Euless, Texas, Dr. Ray. She's a community organizer, and I am excited to have her come in tonight. to ask question to you, Dr. Ray, while we are here on the show. But this is exciting. Kimoa ke hoko ke humariola oku. I just wanna translate this in Tonga, Dr. Ray, because ko fefine ko ni na lea ko kia ina whamatala ko he Dr. Ray. Were all the surgery done in Tonga or in Australia? For the stomach, for the colon cancer, lady.
No, she done it in Tonga, but the doctor was from Australia.
Okay. Aya ko tafa ko ni na to tolu na was kamata va head pet and I kana ma fa mari he weekend ni ke lea ki he fine ko ni ta ni mafa. The very first time he treated her, Dr. Ray, I know na ihe mohenga bedridden for 5 months. She having hard time eating. She did not eat at all, Dr. Ray, yeah, for the last 5 months, eh? And when you first treated her, Dr. Ray, did she? Can you explain the first treatment you gave to her? Dr. Ray, can you hear me?
Yeah, what did you say?
What I said, can you explain after your first treatment with the 54-year-old lady?
Yeah, after the first treatment, during the treatment, she started to feel her breathing, and she started to feel like something moving on the stomach.
Wow.
And the second treatment, after the second treatment, she stand up and walk.
Wow.
The first treatment, before she's hard to talk, but now she's talking because she can breathe in, breathe out. She's drinking, she's eating with no vomiting anymore.
Yeah, I know
So
the
she's
daughter.
not relying on the dog.
I know the daughter told me, I think after the first treatment, she was asking to eat something and then the watermelon, huh? So that's amazing to at least have first treatment to show a good sign, you know? So
I told the daughter and I told her sister, when someone been for a long time can't eat, so I told them she can have like something watery like watermelon, to
something
just like
soft.
start to feel. But I tell you, it's amazing when you start to feel the food going all the way down,
Right.
you know, and you feel the water. When you drink the water, it's a blessing. Um, you know, when I study medicine and I deal with patients, I recognize that what we have, it's wishes for others and big wishes for others. When
Right.
we have the food, when we eat, a lot of people wish if they can eat. When we drink water, a lot of people wish if they can drink. So what we have in our hand, actually we don't feel it, but we can see when other people suffered how gifted we are. Because some people they said, where is the blessing? Where is God? Why God is punish me? No. If God punish you, I'm telling you, there's go and look around and you'll see how blessed you are.
Yes. And
When
you
you
know,
see
Dr. Ray,
people
one
they
of the
can't
things,
drink or they can't eat.
right. You know, Dr. Ray, one of the things that I know we spoken with the lady, the preparation for her funeral. You know, all the fine meds were already wrapped up in the home, ready for her funeral. That's amazing when we hear her talk to us, and you know, very emotional. But like like we said, always thank Jesus, eh? For my love, mo pe ke o wa he time ko to pe o ku ho kwai ha mo ui o ku ta pe ku fa mo ui he eiki, eh? It's a little device, Dr. Ray, but it works wonders from, you know, the way I look at it. Leola, you can log out and log back in if you can hear me. and you can just come in the audio if you're having a hard time with the video. But Dr. Ray, maybe we can take a break and because we only have another 10 more minutes. You know, the guy from last week, Dr. Ray, Salesi, Kaufusi, I am going to play one of his songs. I know you said we are going to take a break and play one of his songs, and then we'll wait for Leola to see if she come back. Is that okay, Dr. Ray?
Okay. Okay. Saibe.
What the hell, Benny? My mic is open. When your mic is open, it's all for the fathers who are listening tonight, Dr. Ray. And happy Father's Day to you, Dr. Ray. Okay, back to us here. I know Dr. Ray, one of the questions that she wanted to ask, I think hopefully she'll be back on here. She wanted to ask about her arthritis. Leola has arthritis. She's trying to come back in, but we can, if you can, Leola, what specifically that you wanted to know about your arthritis? Dr. Ray can answer the question. She said she can hear us and she can see us both, but she's asking about her arthritis, Dr. Ray.
Okay. What her stage and arthritis? Which areas affected? Can you hear me?
Yeah, I can hear you. Okay. Leola, ko ha I feito iho sino
Okay.
arthritis. I'm asking you the question right now. So. Okay, the knees and the legs. Dr. Ray, can you see the question, the answer?
Both or one? Both or one?
Fatoloa I tui pe mo vae. Mo vae. I believe it's both because she put legs, so.
Okay, what I'm asking, because we have something called septic arthritis, or we have rheumatoid arthritis. So that's why I want to be specific. And we have the psoriatic arthritis. So we have different type of arthritis. Which type she have? That's what I'm asking.
Yeah. She's coming in, but her device is not connected. Kapag fanang may liola ke fihuiat ko niya Dr. Ray o kalasi wa arthritis. Pag nefema o ke ilo pe ko both of your knees and your legs or so what type of arthritis you have?
Like we have psoriatic arthritis, we have rheumatoid arthritis, and we have the septic arthritis. So we have 3 different type of arthritis. Do you want me go one by one and then she can tell us which one she have?
Yeah, I'm waiting for her to respond to that one. Because she said she can hear us and she can see us well. So I'm pretty sure she's taking her time to type it though. I have classic arthritis. Okay. Both my legs feel really tight lately. Okay. I'm reading what she's putting out here, Dr. Ray. On the
Okay.
screen.
So sound is like okay, it's like it starts suddenly swelling. What the color of the skin? She get fever or not?
The doctor said my knee has arthritis, but don't know which one of the three. So she's not sure which one of the three. So
She's in America.
yeah, she's in Texas. She
What
said
type
no
of
fever.
doctor she visit?
What is it, Dr. Ray?
Okay, for example, if I told the patient you have arthritis, I need to be more specific with my patient. If I have patient, I need to be more specific. What type of arthritis? Rheumatoid arthritis or thoracic arthritis? Okay, with your knee, do you have any
She
skin
said no
change?
fever. No fever.
No.
Okay.
Okay. Any skin problem? Itchy, colors more dry?
Let me see if I can put her on the phone on the call, because I can call her.
Okay.
Let me call her right now. I think we can put her on the call, Dr. Ray.
Okay.
Okay, no skin problem is starting to turn darker. Okay. Leola, pick up your phone. I'm calling so you can talk. Okay, now, Dr. Ray, say hello to Dr. Ray. We have Leola on the line.
Hi, how are you?
I'm fine, thank you. Well, I went to a chiropractor first.
Oh, yeah.
I went to the chiropractor first, and then he x-rayed my whole body, my spine and my legs, and that's when he says I have arthritis on my right knee. My left knee is okay. He said my right knee has arthritis. So it's getting worse and worse. Like on 2 days ago, I was sitting on a chair, and all of a sudden, both feet were feel really tight, like that. Almost feel like that.
Sometimes you feel like shivering?
Really numb, really numb. So I had to take my shoes and my socks off so I can shake it off to have circulation going. And so I don't know what it is. And it just happened 2 days ago, and ever since then, I feel it's really tight.
Okay. Let me explain to you. Sound like septic arthritis, which is this mean you get severe pain in the joint, usually in one joint, not like you get like knee and the other knee is okay, and it starts suddenly and swelling around the joint. The skin color change because you said like the skin start to be like getting darker, yeah?
Yes.
Did you feel shivering?
No.
Like pharmacia?
You know when you are shivering, like
Like pharmacia?
Ikai.
No. She said no.
Okay. All right. I tell you, this one actually you need vitamin D for it.
Okay.
I think you can go up to 10,000 vitamin D3 a day, and you need to drink like Inuvi, and I'm talk about Inuvi like 5 liters a day.
4 liters a day.
5 liters a day. Okay, that's good to know. Because I drink water. I don't drink anything else, but I don't know how much water is enough, or. Okay, 5 liters.
What type? Can you take the photo of the water, the ingredient inside the water, like the calcium level, magnesium level, the pH level? I want to see this one because it's very important. Any other disease you have, or just arthritis? Any other medication you take?
I have high blood pressure.
And what else?
High blood pressure.
Yeah, just a high blood pressure?
Yes.
Okay. You are overweight?
I was overweight. I was 310, 5'9", and I was with nutritious doctor, and I lost 60 pounds. So I lost 60 pounds from 310. So I'm on about 350, 354, 368. I mean, 2. I'm sorry, 2. Yeah.
Okay.
So
Can I ask you one more thing? Did you like to eat beans like white beans, green beans, brown beans, any type of beans?
yes, the doctor ordered me to eat beans, different kind of beans, green beans and dry beans. So I have stopped now, but I was eating it for straight 3 months.
What I'm asking you that because most probably the arthritis caused by people they eat beans, especially white beans. White beans, yellow beans, brown beans, these cause this type. So that's good that when the doctor advised you to stop eat beans. Okay. With the iTeraCare.
He told me to eat. He told me to eat beans. I stopped eating beans.
Yeah. You can't, because if you eat beans, it will getting worse. You know, we need to understand what caused the disease. So the first treatment, the first step, you need to stop what trigger the disease. And for me, like beans, one of the big thing, ikai. No, big no for you. Okay. So with the iTeraCare, you need to have the water and vitamin D, and I want you to go to vitamin D to 10,000 unit a day. Okay, and you will use iTeraCare. You will use iTeraCare in your knee, in your body, but not to your head because you have high blood pressure. And I will, when you get the device, I will show you how to use the device on your arthritis. Most probably, if it's very bad and severe one, it can take up to 3 weeks. But from first treatment, you feel like you are in heaven. I'm telling you.
Okay.
Okay. I have a lot of patients with severe arthritis, even rheumatoid arthritis. So rheumatoid arthritis is very bad than septic arthritis or cirrhosis arthritis. But they get well from first treatment. They can walk straight away. Okay.
Yeah.
So yes, you need iTeraCare. The iTeraCare is good for you because they have the heat therapy and they have the frequencies. So the heat therapy, it's good for arthritis because it make you feel warm in your joint. There is no momoko. Okay? And then the frequencies come to kill the joint inflammation. And then you have the light. Yes, that's the frequencies to break down the inflammation in your joint. So here you have you have the heat, which is make you feel more comfortable and relax in your joint. And plus you have the frequencies. The frequencies go and kill the inflammation in the joint. And then you have the light, and this will fix the skin color in your knee.
Wow.
Okay. You probably have 3 devices in one. Okay. And the frequency there is so friendly to use. I tell you, you will love it. You will love it. I feel like you will hug the device and kiss the device all the night after the first treatment. You will feel it straight away. I'm telling you.
Okay.
Okay. But you can walk or hard to walk.
Say that again.
You able to walk or hard to walk?
Yeah, right now I'm walking with a cane. Right now I have a walker, but it's depends. You know, like now I have a cane to help me my balance because my balance is not good either. Yeah.
Okay. We will go one by one, and I will give you demonstration like video, how to use this one here and how to use this one there. But I'm telling you, even if you are using a walking stick, within 1 week maximum, you will be walking and dance Tongan dance. Then Maybe next time we will have a video with you dancing Tonga dance. I'm telling you.
Oh my
This
goodness.
my promise to all my Tongan patients. They come with me in a wheelchair and they can't walk. I told them, give me 1 month and you'll dance Tongan dance, and they come dancing. I'm telling you.
Oh my goodness, you're a miracle. I'm so glad I listened to my friend Emelina's station here. And when I walk, I'm going to come run and look for you.
Of course, yes. I have, before the lockdown, I have this patient in my clinic. He called his brother in Texas. And he asked him to come to Tonga for him because he have problem in walking. He was one of the rugby player in Tongan team before. Then he migrated to America and Texas. But the funny thing, when the brother he came on the Christmas time before the lockdown, and he came to my clinic. He was so busy, and then he told me, I came here because my brother keep calling me from Tongan to come to have the treatment here because I can't walk. And I told my brother, since when someone sick come to Tonga to get healed, we always go from Tonga to overseas. And then I was laugh and I said, okay, but this guy, before he left, his son 28 years old, and was first time for him to see his dad walking properly without a stick. He told me, since I born and I can open my eye, I always see my dad struggle in walking. And this was first time for me. And the guy was crying because he told me, I miss playing with my kids of my knee problem. And he left Tonga walking and so happy with what I did to him. But anyhow, in Texas, I forget his name.
Wow.
But yeah, it's a good story. But I'm telling you, if you listen for what I'm saying, okay, vitamin D3, it's good. It's good for your heart, good for knee. But I want you to, during the treatment, to increase up to 10,000 units a day and Innovi.
Okay. Yeah.
Okay.
I'll absolutely
And
do
then,
that. Yes.
Yeah. Okay. And then we'll see. But I'm telling you, like, within 1 week, we can interview you, and when you introduce yourself to us with Tongan dance.
Yes. I'm going to order my machine from Melina tonight.
Yes. Okay.
So I can start with it.
Okay. We'll talk to you in a minute, dear. Did you have any other question?
Yeah, because we already finished our show.
Yeah.
No, I don't have any other question.
Okay.
Yeah, no more beans for me. Yes.
Okay. Malo Leola for joining us, and then we'll be talking to you after the show, right?
Yes.
Okay, Malo. Thank you.
Yes. Thank you, Dr. Ray.
You're welcome. Ofatulahi.
Yeah.
Okay.
Malo. Okay, Dr. Ray. Final word, because our time is up, and then I need to call her to order her.
I just wish everyone. I wish everyone happy. I wish everyone happy Father's Day, as we wished Happy Mother's Day. And I wish everyone to just recognize how gifted we are, because what we have, it's big wishes to others. So if you can eat, if you can drink, if you can breathe, and if you're still alive, that's a big wish for others. Okay? And for me, I can't imagine when you just like, I put myself towards my patient. If I sit in my bed and I found the people prepare my funeral and my Tongan mat to ready, that will be wrapping my body and this, how I feel. I would be down. I feel like I already died, and I've been like sitting on the bed, imagine my funeral and how I will meet God. It's horrible feelings.
Yeah, but it is a horrible
at the end
feeling.
of the day, I want everyone to think Yeah, it is. You know, the lady, when she started to talk and eat and drink, she was crying.
Yeah, I know. When I
And she
spoke to
told
her, she
me
was crying. Yes, that was
yeah,
very emotional to me,
she's not
Dr. Ray.
ready to die. Yeah.
Mm.
Can you imagine, like, when you see, I just
People,
like feel like I'm sitting watching my coffin there, ready to take me. It's
yeah,
not good.
it's very sad, right?
I
It's
never
very
seen
sad.
this anywhere, but at the end of the day, we respect the culture,
Yeah.
but we do our best. We do our
Mm.
best, and Jesus do the rest. And this is my
Amen.
word. Everyone enjoy the Father's Day.
Yes, and happy
Okay?
Father's Day
And
to
I
you,
will
Dr. Ray.
thank you, Emily. And
Mm.
you talk to me after you talk to her. Okay?
Yes, we'll
All
do
right.
that.
Opa to bye.
Fato malo pagalaba
Okay.
daw po kalama ke poni. Malo mo me mai ko Emily ni fa umlite. Uh, mo me
Tonga ko